All right, so let's jump right into this neurological emergencies.
Oh, yeah.
You know, when every second counts.
Absolutely.
We're talking strokes, we're talking brain injuries, anything that causes that really dangerous pressure buildup inside the skull.
Right.
And we know that hypertonic saline, that's one of our go-to treatments to bring down that pressure.
Yeah, one of the first-line therapies.
And for years,
Yeah.
the standard's been using central venous catheters, those CVCs,
Right.
to give that 3% hypertonic saline.
Exactly.
But, you know, it takes time to get a central line in place.
Oh, absolutely. Especially in a crisis.
Especially in a crisis, right?
Yeah, it takes time, and it comes with its own set of, potential complications.
Absolutely. And time that we often don't have.
Right.
So this study in neurocritical care really caught my eye.
Yeah.
Because it tackles that very issue.
Uh-huh.
They investigated using something that we've got readily available everywhere, peripheral IV catheters, PIVs,
Right.
to deliver these 3% hypertonic saline boluses.
Right. Wow, interesting.
Yeah, and what's really neat is they didn't just theorize about it.
Yeah.
They looked at real-world data.
Okay.
This was done at Sisters of St. Mary Health, St. Louis University Hospital.
Okay.
And they reviewed cases from 2019 to 2022.
Got it.
So we're talking 124 patients
Yeah.
who each received at least one 3% HTS bolus through a PIV. And get this,
Yeah.
they infused it fast
Okay.
at a rate of 999 milliliters per hour.
999 milliliters per hour through a peripheral IV.
Yeah, so that's incredibly fast.
Right.
I mean, were there any safety concerns about pushing that much hypertonic saline that quickly
Yeah, that's a great question. I mean,
through a peripheral line?
you would think so, right?
Right.
But the safety profile was surprisingly good.
Oh, what?
Out of 216 bolus administrations, only 8 resulted in any complications.
Okay.
Which is a really low rate, like 3.7%.
That is low.
Yeah, and when you break down those complications, they
Yeah.
were mostly minor, pain at the injection site.
Yeah.
A little bit of phlebitis, inflammation of the vein, some minor vein thrombosis,
Okay.
and just one case of extravasation,
Right.
which is when the fluid leaks out of the vein.
Yeah.
And importantly, no severe complications like hypotension were reported.
Okay, well, that is reassuring.
Right.
But the big question is, did it work?
Yeah.
Did they actually see a drop in that intracranial pressure?
You bet they did, and it was quite a dramatic drop.
Really?
The median ICP went down by a full 6 millimeters of mercury after the 3% HTS bolus.
Wow.
And to really isolate the impact of the hypertonic saline,
Yeah.
they looked at the data again.
Okay.
But this time they excluded the patients who had also received mannitol.
Okay.
And guess what?
No.
That reduction in ICP remained statistically significant.
Wow. That's pretty compelling evidence.
It is.
So we're talking about a readily available solution
Yeah.
given through a readily available access point,
Right.
leading to a rapid and significant
Yes.
clinical improvement.
Yeah, precisely. This has major implications for how we might respond to these time-critical neurological emergencies,
Oh, absolutely.
especially in those crucial first few minutes.
Yes.
Imagine paramedics in the field, or even in a busy ER,
Yeah.
where getting a central line in isn't always immediately feasible.
Absolutely.
This could buy us precious time.
Yes.
Time that translates to a better chance of preserving brain function and
Yeah.
improving long-term outcomes for our patients.
Exactly. And while this study focused on 3% HTS, there's been a lot of interest lately in using even higher concentrations,
Right.
like 23.4% hypertonic saline.
Yeah, 23.4% hypertonic saline.
But that comes with its own risks.
Absolutely.
And it often requires a CVC for administration.
Exactly.
So this 3% HTS through a PIV
Yeah.
seems like a potentially safer
Yeah.
and more accessible option,
For sure.
particularly when time is of the essence.
Right.
But of course, like with any research,
Yeah.
we have to acknowledge that no study is perfect.
Right. There are definitely limitations to keep in mind.
Yeah, what are some of the limitations?
Well, this was a retrospective study, which
Right.
means they looked back at data that was already collected,
Yeah.
and it was conducted at a single center.
Okay.
So to really solidify these findings,
Yeah.
we need more research.
Right.
Ideally, those large-scale prospective trials.
Those are all valid points. But even with those caveats,
Yeah,
this is still compelling evidence that deserves further attention.
absolutely.
What struck you most about this research?
You know what I find most remarkable is how such a simple intervention can potentially have such a profound impact.
I agree.
We're talking about using existing resources in a slightly different way and seeing a potentially game-changing effect on patient outcomes.
Absolutely. And, we're all about practicality here.
Right.
So let's dive a bit deeper into the specifics of this study.
Okay.
And what it might mean for clinicians on the front lines. What were the specific patient demographics and diagnoses included in this study?
Yeah.
I think that's important for our listeners to consider when thinking about how these findings might apply to their own patient populations.
Right. You're right. Context is everything. So in this study, the average patient age was about 57, with a slight majority being male. Most were white, which is a point to consider in terms of, generalizability.
Right.
And the diagnoses they looked at were pretty representative of what you'd see in a busy neurocritical care unit.
Okay.
Intracerebral hemorrhage, acute ischemic stroke, and traumatic brain injury.
That's helpful to know. It gives us a better sense of the types of patients who might benefit from this approach.
Yeah, and something else that's important to highlight is that the study did mention a potential for underreporting of minor complications.
Okay.
Especially since many of these patients were not fully conscious during treatment.
That's a fair point. It's always a challenge to capture all the nuances of patient response, especially in those acute situations.
Right.
But even if the actual complication rate is slightly higher than reported, it still seems to fall within an acceptable range, particularly when we weigh it against the potential benefits.
I completely agree. And it's also important to remember that the study focused specifically on a rapid bolus administration of 3% HTS.
Right.
That doesn't mean there's no place for slower infusions, which might be more appropriate in certain cases.
Right. It's all about tailoring the treatment to the individual patient and their specific circumstances.
Exactly.
But what this study does is add another tool to our toolbox.
Yes.
And a potentially very powerful one at that.
Absolutely. Now, I know we're always thinking about the practical implications for our listeners, those healthcare providers on the front lines.
Right.
So the big question is, should we all be switching to PIVs for 3% HTS administration immediately based on this one study?
Well, hold on a second. As with any new research, it's important to approach it with a healthy dose of skepticism.
Sure.
This study provides compelling evidence.
Yeah.
But it's not the definitive answer.
Of course.
More research, particularly those larger prospective trials, is always needed to confirm these findings.
I think that's a really vital point. We don't want to just jump on the bandwagon without a thorough understanding of both the potential benefits and the potential risks.
Exactly. But I do think it's safe to say that this study warrants serious consideration and further discussion within our clinical communities. It really opens the door to a potential paradigm shift in how we manage neurological emergencies.
Absolutely. This research could lead to changes in protocols, especially in pre-hospital settings and emergency departments. It might also encourage hospitals to reassess their guidelines for hypertonic saline administration.
And that's exactly the kind of critical thinking we want to encourage.
Right.
It's not about blindly adopting a new approach, but rather thoughtfully integrating new knowledge into our practice, considering the nuances of each patient and situation.
That's the key takeaway. This study is a call to action for all of us to stay informed about the latest research, critically evaluate its applicability to our own settings, and engage in thoughtful discussions with our colleagues.
Couldn't have said it better myself. Speaking of staying informed,
yes,
we highly recommend that our listeners check out the full study in neurocritical care.
Yes, definitely take a look.
It's packed with details and insights that we simply can't cover in our limited time today.
And we'd love to hear your thoughts.
Yes.
Have you had any experience using 3% HTS via PIV for neurological emergencies?
Yeah.
Share your insights and experiences with us on our social media platforms. Let's keep this conversation going.
Fantastic idea. Now, before we wrap up, I want to leave our listeners with one final thought-provoking question to ponder.
Okay.
If this shift towards PIV administration of 3% HTS gains wider acceptance, what broader implications might this have on the healthcare system as a whole?
Ooh, I like where this is going. Hit us with it.
Well, for starters, it could potentially lead to a decrease in the use of CVCs in these emergency situations.
Okay.
Which in turn could reduce the risk of complications and healthcare costs associated with central line placement and maintenance.
Yeah.
It's not just about the immediate treatment, but also the potential downstream effects.
That's such an important point. It could impact everything from resource allocation and training protocols to even the design of emergency medical kits.
Wow.
This seemingly simple change could have ripple effects throughout the entire healthcare system.
Precisely. And it reminds us that even small discoveries can have a profound impact on how we practice medicine.
Absolutely.
That's what makes this field so incredibly dynamic and exciting.
Couldn't agree more. It's all about constantly learning, adapting, and striving to provide the best possible care for our patients. And sometimes those breakthroughs come from the most unexpected places.
Yeah, it really highlights how something as seemingly straightforward as changing the route of administration for a medication
Right?
can potentially have a ripple effect throughout the entire healthcare system.
Absolutely. It could even change how we train future healthcare providers.
Oh, yeah.
Imagine medical students and residents being taught this technique early on,
Yeah.
becoming comfortable with it,
Yeah.
and advocating for its use as they move into their careers.
That's a great point. It's about empowering healthcare providers with new tools, new knowledge,
Right.
and encouraging them to constantly question
Yeah.
and refine those existing practices.
And that's exactly what this study does. It challenges the status quo
Right.
and encourages us to explore new possibilities for improving patient care.
Yeah.
It's a win for both clinicians and patients alike.
I love that perspective.
Yeah.
So on that inspiring note,
Yeah.
we want to thank all of our listeners for joining us on this exploration of the potential of 3% hypertonic saline administered through PIVs for neurological emergencies.
Yes. Thank you for listening.
We hope this episode has sparked some new ideas, encouraged you to think critically about your own practices,
Yeah,
and given you some practical takeaways to consider.
for sure.
Remember, knowledge is power,
Right.
especially when it's shared and put into action.
Absolutely.
So keep asking those tough questions, stay curious, and we'll see you next time for another exciting look at the cutting edge of healthcare.
Don't forget to check out the full study.
Yes.
Rapid administration of 3% hypertonic saline boluses via peripheral intravenous catheters for the management of elevated intracranial pressure in neurocritical care patients, published in Neurocritical Care.
And as always, we encourage you to share your thoughts, experiences, and any questions you might have
Yes.
on our social media platforms.
Absolutely.
We love hearing from you.
Yeah, we love to hear from you.
Disclaimer and bibliography in the description.